Today's podcast is brought to you by Cascade Health Alliance. Joining us today is Merritt Driscoll, Executive Director of Healthy Climate. Welcome, Merritt.
Thanks so much for having me.
As the Executive Director for Healthy Climate Coalition, what is the role of Healthy Climate Coalition and in promoting health and well-being within our community?
So Healthy Climate is a multi-sector partnership. We work with organizations across the community to improve health and well-being. We have representation from over 40 different organizations and agencies across the community, and we work together to accomplish the common goal of improving health and well-being in Klamath County.
What is a community health improvement plan, and how does that help the community itself?
An important part of community health improvement work is promoting and protecting the health of our community members. And we do this through the Community Health Improvement Plan process. So we work collaboratively with organizations and agencies across the community to collect data and find out the true need in Klamath County. And then from there, we develop a long-term systematic plan to improve community health. So we work collaboratively with organizations, and we define our goals, our objectives, our strategies, our timelines, and our measures of success. And we lay this out very clearly in the Community Health Improvement Plan. In this plan, we lay out our programs that we're going to develop, the policies that we're going to implement, and our plan for success to improve health factors and health outcomes to drive progress to improve wellness in Klamath County.
So how does Cascade Health Alliance work with you regarding the Community Health Improvement Plan?
Cascade Health Alliance has been an essential partner in the work that we do around the Community Health Improvement Plan work. Your staff, they sit on all of our Community Health Improvement Plan priority areas to help drive and implement progress. So you guys are a key player in our health equity work, our mental health work, our work to improve food insecurity, our work to increase physical activity opportunities. And honestly, Cascade Health Alliance, you guys were essential in even creating Healthy Klamath back in 2012 and have been an essential partner since then. You guys have invested in a lot of the projects and the programs that we've implemented. And I think, Cascade Health Alliance has just been such a key partner to drive progress and the key outcomes that we've seen in our community. And I think it's shown by your participation in the work, your staff support, and your investment in the community projects.
So when you look at Climate is one of the first certified Blue Zone in Oregon. Can you tell us what is Blue Zone?
So blue zones are areas around the world where people live the longest, healthiest lives. And it was discovered by a National Geographic explorer, Dan Buettner, who actually traveled the world and circled blue zone areas with a blue marker. And he took the key principles from these blue zones and he focuses and works with communities to implement best practices to kind of reverse engineer health and wellness in communities. So in order to become a Blue Zone certified community, we had to implement a series of best practices. We worked with work sites, restaurants, grocery stores, faith-based organizations. Additionally, we had to pass a number of policies in tobacco prevention, food, and then the built environment, our infrastructure work. And then we also had to engage individuals across the community and implement best practices or encourage them to implement best practices in their lives. And then on top of that work, we had to see true progress, meaning outcomes were actually occurring in our community. So we measured outcomes like reducing tobacco use and increasing access to food and graduation rates and that sort of thing. So for 5 years, from 2015 to 2020, we implemented a series of best practices. And then finally in 2020, we accomplished what we set out to accomplish and truly saw our community transform and our health outcomes improve.
When you look at the health outcomes within the community itself, which there are like top 3 initiatives that you can put your hand on that you say, gosh, man, we were successful?
Ooh, that's a good one. So I think The health outcomes that we are the most proud of are the ones that have true sustainability and lasting outcomes. So for instance, passing a tobacco-free city parks. That is something that's going to change the landscape of our community for generations to come. And we did successfully see our tobacco rates reduce. Another thing that we were really proud of is increasing access to local food. We created a year-round online marketplace that's now fully owned and operated by our local farmers. We also saw success in increasing access to local food by partnering with a local organization to start a preventative food pantry, providing additional local food to families in need. And so I think kind of setting up and developing these key sustainable programs that will affect the health and well-being of populations for generations to come is really a huge success, I think, for our community and for the work that we do.
So when we look at population health and the work that Healthy Climate Coalition does, where do you see the future? Where do you see the future of Healthy Climate Coalition?
Well, I think we are going to continue to assess where's the key need in the community. We do that every 3 years through our community health assessment. And we are going to continue to drive progress through creating this unified community health improvement plan. I see mental health being a key area of focus that we're going to need to collaboratively come up with a way to focus our efforts and really see a true systems change there. Health equity is another area of focus that we're spending a lot of time and attention to kind of clearly define what does that mean to our community and how can we truly affect change. And then another area of passion for our staff is our infrastructure projects, and Cascade Health Alliance has been a huge proponent of that, building parks and playgrounds and working to beautify our community to increase that community pride. So those are some key areas that we're going to continue to focus on to improve the health and well-being of our community.
And it sounds like a lot of the work that that the Healthy Climate Coalition are doing is aligned with social determinants of health and health equity. Do you see similarities? How do you feel like CHAR can collaborate more effectively in the future?
So social determinants of health is a key focus area for the work that we do. Access to services and transportation and housing, and meeting the basic needs of our community is so essential. And I think we already appreciate the work that Cascade Health Alliance is doing in this realm. For instance, you guys help support the collection of primary data to kind of assess where our community, where we are in terms of social determinants of health and the data around it. And then I think also what is really essential, and we need to get the word out even more, is Healthy Climate Connect, which is a fabulous resource in our community and a referral system to help increase access to care. So we are so thankful for all that you already are supporting around social determinants of health and look forward to continue that work together to truly drive progress.
For members looking at this podcast, can you describe to them what is Healthy Climate Connect and how do they access that?
So Healthy Climate Connect is a resource for all of the community. If you're looking for services around housing, any needs you have, whether they're medical or the basic needs, clothing or any sort of service, you can go on to Healthy Climate Connect and find access to the resources in our community locally. And then additionally, on the back end, it's also a closed loop referral system. So it's a great resource for our healthcare agencies to refer patients to the services that they need and without them kind of falling out of the system. It's that closed loop so that they can access the services they need and get that follow-up.
Merritt, thank you so much for all your answers. For all our followers, if you want to learn more, follow us online.